we're Team 4, and our proposal is on a drug-eluting degradable polymer stent.
I'm Kirsten.
I'm Sunny.
I'm Roger.
And I'm Leah. So did you know that as a woman, in my lifetime, I have a 1 in 455 chance of developing esophageal cancer, and the chance only increases for men, and it's 1 out of 132. And current treatments for esophageal cancers are surgery, radiation, chemo, laser therapy, very, very invasive procedures. So there's a definite need for a minimally invasive procedure. Even after these maximally invasive procedures, there's only a 20% chance that you will be alive 5 years following your diagnosis. So we believe that our product that we're going to create will be extremely profitable if we sell it to hospitals that treat patients with esophageal cancers and obstructions, as well as including the manufacturers in the process and seeing if it's a feasible solution. So it's important because right now the current stents on the market, which is what we're trying to develop, are cardiovascular based in their applications, and most are non-degradable. And out of the stents that are on the market, there's uncoated and drug-eluting, and uncoated tends to lead to stent restenosis, while drug-eluting, it does decrease your chance of restenosis, it increases your chance of thrombosis.
So our proposal to solve this issue is to design a PLA stent with polyurethane coating loaded with paclitaxel, an anti-cancer drug, otherwise enhanced healing growth factors or obstructions for patients without cancer. So we are choosing PLA because it takes a long time for PLA to actually degrade. It takes about 2 to 3 years, and the patient wouldn't need a revision surgery for this, but it will degrade over time. But PLA doesn't degrade too rapidly, so it will still be able to provide structural support. Polyurethane is the coating that we chose because it's an excellent drug deliverer, and it also degrades faster than PLA, which we'll talk about in a sec. Paclitaxel is a less toxic cancer drug that could be used for elderly patients. And the reason why we're going with polyurethane, because it degrades faster, is because we don't want the toxic drug to be in contact with the healthy tissue for too long. So once that degrades, the PLA will still be able to provide structural support. So our methodology for this is to first create a PLL stent and to prepare it in such a way similar to the Igaki Tamai coronary stent, which is a zigzag PLA stent. It's high molecular weight PLA, and it self-expands in the body when it reaches body temperature. Then we're going to dissolve the polyurethane solution with paclitaxel with growth factors, and then electrospray it onto the PLA stent, and we're going to deliver the stent via a balloon and have it self-expand, and then the stent degrades over time.
So some of the benefits of our solution are that it decreases the need for the standard cancer treatments like chemo, radiation, and surgery, which decreases the patient's hospital stay and the associated costs and improves their quality of life. The stent is also able to be used with different types of drugs and provides for better localized drug delivery in a minimally invasive way. Some costs to consider are the FDA approval process, which can be long and expensive, especially considering animal and clinical trials. And there's currently not a suitable in vivo animal model for GI cancers. And then we would also consider finding the proper dosage for the drugs, as well as costs of product development.
And finally, we'll look at why our solution would be preferable over the others that are currently in the market today. Currently, there are care plans that include surgical removal of the region with cancer. So either the person would have to continue to be fed through a tube or have some sort of bypass surgery afterwards, so that the esophagus could be attached to the stomach again. Other options would be using endoscopic therapy, radiation therapy, immunotherapy, targeted therapy, and chemotherapy. And our solution is preferable because our stent will be minimally invasive, meaning that we won't have to puncture or make any incisions during the surgery. It would only be going into the esophagus. It would also not have any corrosive properties and is degradable because we're using polymers that are designed for these purposes. This stent will also be drug-eluting, meaning that we can get drug into the desired location, such as where the cancer is, and just generally the stent can clear any blockages upon expansion.